So I like to start back with sort of childhood, just generally. Where did you grow up? What was your childhood like? Were you healthy, unhealthy?
Yep, I was very healthy. My childhood was pretty good in Cheltenham. It's pretty normal. Yeah, I was a very healthy child. I wasn't really into sports and things. I think I did sports after I left school. I started getting into weight training and sort of keeping myself fit. Just became a way of life. But it was while I was at school. I remember sort of hiding in the. Well, I'd come in with a note. Sort of, I was one of the ones that didn't want to go out in the cold. I was at a school that was run by priests, very, very good. It was a very good school, and they were very good teachers and very good. And it was a Catholic school. I wasn't a Catholic, but yes, and they used to get us to go out in the cold and run sort of all the way around the school and up the hill in freezing weather. And I was a tiny little skinny thing that used to hate the cold, so I'd come with a note. But when I left school, I things changed quite remarkably, and I did a lot of keep fit.
What did you do after what I refer to as high school, the post-secondary, or what did you do post-secondary school?
Right, I studied art, European political history, and sociology for A level. I then went on. I didn't go back to later on, to be honest. I did my degree in fine art much later, in my 30s. When I left, when I left school, I eventually went into electronics as an electronics engineer. It's just a job. It's something I probably didn't really want to do. I wasn't that interested. I wasn't that much. It wasn't, it wasn't a drive like electronics is with some kids. It was a job. I really wanted to get back and make art. And I spent, it took me till I was in my 30s to actually decide to go back and do a degree in fine art. I'm majoring in philosophy, but sculpture and fine art was the thing that I really wanted to do. And it was marvelous. Probably the best years of my life.
Wow.
I think I actually did a foundation course as well, late. That was probably one of the best things that I ever did. I think everybody should do an art foundation course in life. It should just be part, either that or join the army as a. It was extremely good. I think probably you should do both in life. I could see there's a need probably in this country to have the old. Do you remember where we had in the 1950s? We had conscription. I think it's
I've read about it.
Either that or a foundation course. Both very different, but they both achieve sort of similar objectives. I don't know.
Discipline.
But yes, it was extremely. I was already quite disciplined by the time I got there, but there was a lot. It teaches you to be disciplined. I think making art teaches you to be disciplined. You have to think. You have to discipline your thoughts, and I was really quite sort of, what's the word for it? Well, I really went for it. I really wanted to sort of get on, and I pushed myself really hard. It was really unfortunate. It was after I left college that I started getting problems for the first time. And there's a lot of possibilities in terms of how I developed chronic fatigue or ME. In the first place, and ended up at this point with the lactic acidosis because I did have, I had rebuilt 3 houses. Well, I'd worked on them, and I'd got involved with some pesticides, and I was actually at the point that I started to fall ill. This was in the before I got really ill. This was probably 1990s, mid 1990s. Well, no, actually early 1990s. That's when I'd actually had the nearly forgotten now, so long ago. When I'd been involved with pesticides, I was actually sent into Loftus after they'd sprayed the loft with pesticides, and didn't know that it, what had occurred. But I started having mild problems from that point. And I then went to work in the loft space, cutting, sawing the timbers that had been treated with these. I later went back and had someone actually take a look and find out what was in there. And there were someone had treated it again and again. It had been treated over a number of years for the same woodworm. And when I went back, I decided that I wanted to floor the loft. I needed an area to store my sculpture. The loft was at, someone had sprayed over sort of 3 or 4 inches of dust and debris. My house was built in about 1840s, and it must have been sprayed again and again. Well, I got a shovel and dustpan and brush, and I fell ill on the spot. That was the first time I'd ever really encountered any sort of really weird problems. From that point, I carried on working, getting more ill.
So, Paul,
Yeah.
so when was that you had that really acute downfall, and what were the
Just
symptoms
before I
you
fell
started
ill.
to experience?
It was just before I fell ill, but I was also using non-steroidals as well, non-steroidal anti-inflammatory drugs, for
Okay.
about the same period that I had exposure to pesticides. This was literally just before I fell ill.
What sort of symptoms were you experiencing?
There were fatigue, muscle pain. I would have abnormal fatigue after doing things, but that's what happened prior to me starting to fall ill. I had something. I had non-steroidal anti-inflammatories, which has affected your gut. They can also affect the mucosal lining of the gut and the healing process altogether. In terms of, because they non-steroidals inhibit proteoglycan, a number of different synthesis, and they can inhibit it to quite a high level. I was taking these and while continuing to work, train, and all the rest of it, and I had suffered basically. I've been working extremely hard, lifting heavy weights for both sculpture, for rebuilding the house, and for training as well. So I was a bit of a workaholic. I actually managed to damage both shoulders and collapse my disc. This is the point at which things started to get bad for me. This was exactly the point that which I also encountered the pesticides and was given non-steroidal anti-inflammatories. So it's very difficult for me to know exactly what caused this problem, because there are a number of things that could be
Impacting.
Yeah.
Yeah, so just so I have this clear in my head, so potential factors that may have caused your onset of ME or that diagnosis of ME was the non-steroidal use, the exposure to the pesticides, doing a lot of heavy work where you're doing damage to your shoulders and neck.
Well, it was
a lot of hours.
Yeah. I mean, yeah. And instead of taking a step back, I was the sort of person that would just push. So I used non-steroidals, didn't realize that they masked the pain and inhibited healing. They're probably the worst thing you could have for the type of injuries that I had, but they were also damaging my gut at the same time. And I developed a bowel perforation with sepsis. This was at the point that I fell ill. This is when I had when I started the dilactic symptoms. I don't even know which came first, because I developed infection symptoms along with dilactic symptoms, and they may be related as well.
Can you tell folks what the dilactic acid is? Even though you didn't get a diagnosis of that quite yet, and as you're telling the story, just so folks have an idea of what that is.
Dilactic acidosis is, or dilactic acid, is produced by abnormal overgrowth of gut bacteria in the small intestine. It sounds pretty benign, but it certainly isn't. And I believe that there's a number of different types of bacterial overgrowth that could be affecting some people. IBS, I believe, is caused by bacterial overgrowth. That's at the more benign end. I believe that they're the worst versions of bacterial overgrowth that can cause, basically, the gut bacteria produce metabolites. And at the top end, the metabolite is dilactic acid, probably alongside a number of other metabolites as well. Sheedy and the Australian researchers have done a fair amount of investigation, and it's their belief that there is more than one metabolite involved. And it would explain a lot. But the galactic producing bacteria producing a neurotoxin, galactate, would explain neurological symptoms in a lot of people.
Okay.
This is why I've been interested, because I've been diagnosed with it. When I understood, I've also been told that I had chronic fatigue and ME, and it's my belief that this may be affecting a number of other people as well. I'm highly unlikely to be the only person suffering from this, and as the Australian researchers have already found, galactic acid in a number of their galactic producing bacteria at high levels in a number of their patients. It's a good possibility for symptoms that I'd expected to kill me when things worsened. I fell ill, really ill, in 1999. I'd had the symptoms I'd had that I've told you about, which you would call ME, were very mild compared with the change. In 1999, I developed both infection. This was on top of the other fatigue and the other problems. I developed infection symptoms and galactic symptoms, and they are very hard to tell apart in the early stages, because galactic acidosis acts very much like an infection. It feels like an infection. And I find it very difficult. I've had sepsis, and I find it very difficult in the early stages to be able to identify the galactic symptoms separately from any other infection, especially at the beginning. At a very sort of low level of it in the early stages, I mean, I have to basically kill it off with antibiotics. But once it starts, I get flu-like symptoms. They worsen, and I can get a number of other symptoms as well. You can feel quite sick. You can get abdominal pain. You can develop muscle weakness. Not all necessarily all together either. You get multiple symptoms, but you don't necessarily get the same symptoms. I've had breathing problems that are so bad from the acidosis itself, because it's the level of acidosis in your bloodstream that causes breathing problems. The neurological symptoms come from it entering spinal fluid, and it can cause all sorts of problems. I've had visual problems, confusion, slurred speech. I don't even loss of balance. They can come and go. The whole thing can fluctuate as well. The levels of galactic production can fluctuate quite in extreme. And I've had periods when the symptoms will just disappear for what I don't even understand, for whatever reason. And then they can come back for months on end. They can vary throughout the day, as in ME. They can vary so much that you're expecting to die. I was from 1999. I thought when we entered the millennium, I thought I'd entered hell. The symptoms were so bad that I was either expecting to die or have to commit suicide. And I actually told they sent me to see psychiatrists, and I told them that I couldn't manage these symptoms. I couldn't live with them. They were impossible to live with. It was very lucky that I didn't do anything like that. And the only reason I think that I didn't commit suicide was because I have children, and the last thing I wanted to do was to leave them fatherless. But there have been occasions I've had to make a will out when these symptoms had got so bad before I was diagnosed that I had to make a will and a letter to explain the possibility, because I wanted to explain that it wasn't their fault if I had to do such a thing, and understand why so many people have committed suicide. And I am expecting some people with ME to have something like this. It's a good possible cause.
So prior to 1999, when you got much sicker, what was your experience with the healthcare system during those years when you were sort of mildly sick?
pretty useless. They did do a lot of investigations. They didn't understand anything. They did find things, but they tended to put down that they hadn't found anything. I actually had frequently raised CK levels. I also had, at the point I was given the somatization diagnosis, I had raised ALT, and it was raised continuously through the period that they were giving me the somatization. I was seeing psychiatrists, and they were
Sorry,
writing down.
so when were you given the somatization diagnosis? And for folks who aren't familiar with that term, what is that? And you also mentioned two other tests that you had high, CK and LT. What are those things?
CK levels show abnormal muscles, or CK levels can also show abnormal heart problems as well, but mainly it's muscle function. ALT is to do with the liver. Raised ALT shows a problem with liver. It's likely that this was to do with the infection I had at the time. The CK levels carried on even when the infection was stopped. But 2 years after I fell ill in 1999, when things changed seriously and I developed dilactic symptoms and infection symptoms, I was given a somatization diagnosis. And I believe that the somatization diagnosis on its own can be seen as a human rights issue in its own right, because it's it's an unreasonable diagnosis based on a presumption that anyone suffering from multiple changing symptoms that remain undiagnosed with normal diagnostic tools for a period of 2 years may be diagnosed with somatization. That's the whole premise. It's crazy.
So they're basically saying that if they can't figure out what's wrong with you with their routine checks after 2 years, therefore it must be psychological.
It's you. So what they're doing is they're saying that if they can't find it, you're the problem. Dilactic acidosis causes multiple changing symptoms. It's specifically that. So, and if you're diagnosed with somatization, it becomes your diagnosis, and no one ever takes you seriously again. It's nicely and neatly swept under the carpet. No one has to deal with you. They don't have to run any further tests because you're nuts. It's just all. Somatization basically is a diagnosis given when they believe that they tell you that your brain is manufacturing the pain and the symptoms. Nicely swept away.
When you got that diagnosis, what was your reaction?
I was really shocked and upset, to be honest. It was more, I was scared. I was extremely scared because I knew I was really ill. I was suffering problems. I was actually, on occasion, even going into shock. From 1999 to 2001, this was probably one of the worst periods that I was ill before they gave me the somatization. I would have chills and fever from the infection. It wasn't the sort of infection that would be permanent infection. It was a massive abscess at the side of my bowel. The non-steroidals had actually caused damage to my mucosal lining and the lower part of my intestine, and had actually perforated. It was only found in 2003. This was from 3 years on, when I actually had sepsis, and then it was very difficult for them to treat. They thought they treated it, and it was still active in 2006. And
oh my God, Paul, let me make sure I heard you correctly. So
yes, I know.
In around 2000 is when the nsteroidals caused a perforation in your bowel and you started to experience sepsis symptoms, which are very serious.
Yeah.
But it was at least
infection
3.
Then. Yeah. It was 3 years, and it was only diagnosed when I actually had sepsis itself, and a huge mass was and a huge mass was found at that point to travel through muscle and all sorts. I'd have started to develop the dilactic symptoms round about the same time. I don't know whether it was due to the infection, whether it was due to the non-steroidals. I have no idea. But the bacterial change that occurred at that point was permanent. I've lived with it ever since. I was actually treating myself after that when I noticed that all the symptoms would go after using antibiotics. This was one of the key points in me finding that I had dilactic acidosis. was that even after the abscess had finally been gotten rid of, and it was checked at MRI that it was no longer active, there was no sepsis, I was still having symptoms of dilactic symptoms, which were treatable with the same antibiotic that the abscess had been treatable with, metronidazole. That was how I got the first understanding that I had to have another infection. I kept going back and telling them from the point from about 2003 continuously that I was having other infection, that I had some other kind of infection. When the sepsis had been completely eradicated, I kept telling them that I was having infection, which I responded to antibiotics. My doctor, who was very good at the time, and he'd actually written a letter, sent it to A&E. He'd actually stated in it, drunk, not drunk, at the top of it, because I'd had periods of drunk-like confusion. These are the dilactic symptoms. And he'd actually stated that I wasn't somatizing and asked for blood gases. And a consultant also asked for blood gases. This was from 2002, the year before. As soon as I changed surgery and moved to some other doctors, they said, "You're not somatizing." But once this was lodged in my record, it's only been removed in 2017 after they actually found dilactic acidosis. I'd gone back. I've fought the hospital continuously because of what happened ever since I was misdiagnosed with it. So I knew it was incorrect. Even after they found the abscess, they still left the somatization in my records. Even though it was absolutely certain that I'd been suffering from a real problem. And this is it. It's the basis of somatization that one of the things I wanted to talk about to you, because the basis of somatization is, and this is something I've got here, it's, here we go, I'll read this out. Somatization itself is diagnosed on the premise that the patient appears to have satisfied, if we've gone into this, the criteria for somatization disorder as defined in the ICD classification of mental illness and behavioral disorders. The main features of somatization disorder are multiple, recurrent, and frequently changing physical symptoms of at least 2 years duration. That means that patients like myself with undiagnosed multiple systemic symptoms, which include infection and dilactic acidosis, after 2 years will be put to a serious disadvantage if diagnosed with somatization, which is a highly prejudicial diagnosis. But this also means, this is where it stands as a human rights abuse. It also means that any patients who have multiple changing symptoms that on average take more than 2 years to diagnose, such as MS, Beckett's, and systemic lupus, are more likely to be diagnosed with somatization disorder. And that is absolutely horrific. This is all based upon this really unreasonable premise.
Absolutely.
And I think
it occurs to me that by taking that stance and by creating that label, they are oftentimes denying appropriate diagnosis for all of those other diseases you just mentioned, and no doubt countless others, and that they're also taking that medical error and embedding it in the system.
Yeah. I think there's a doctor. I think it's MD. Did you see that thing I put online on Phoenix Rising concerning there's a psychiatrist who's actually written, I think it's MD J Francis, I think his name is. He's written a lot about not just misdiagnosis, but I've got it here somewhere, mislabeling medical illness as a mental disorder. He's done a blog concerning this, and he's put online the problems, including stigmatization for patients who have real illness. He's really gone to town on this, and it's really worth taking a look. Psychologist Alan J. Francis, MD.
So when you got this label of somatization, what negative impacts did that have on your health care?
When I changed surgery, I had a really good doctor, and he wasn't closed, and he was the one he stated within a few weeks of getting to know me, he said that you're not somatizing. And he, like I said, he put that, sent that to A&E. But other doctors who I didn't get to know basically took it as my diagnosis. The somatization, it's where it was placed. There's a record in the UK called your significant medical history. It's probably the same in a lot of countries, but we all have a significant medical history. It basically is the first record that a doctor will see, and it basically introduces you as a patient, tells you what's wrong, tells you, tells them what's wrong. It gives you your history, and if you have somatization on there, it's highly influential and highly prejudicial. I didn't get sectioned. I didn't allow any more contact with psychiatrists after that. I steered clear. I'm only now going back to challenge them because of what they've done. I mean, they caused me, they left me literally in hell. I mean, I had something that was extremely dangerous. I had two problems. I had a really serious infection. I was actually having periods when I was going into shock. I had to warm my body up at night on a number of occasions in front of a fire. I was going in and out of these problems. The infection would be, it wasn't a permanent infection, it was fluctuating because it was locked in a pocket. So as it moved and passed through blood vessels, it would enter my bloodstream again, cause problems, and then literally sort of, I would imagine, have cut itself off partially with just different influences at different times. But the dilactic symptoms had started from that point, and they were really serious. I was suffocating at times as well. The breathing problems were, I can't even describe. It's I was seen in A&E, and they actually checked my oxygen level. And then they can be completely normal. The point is that this affects your mitochondria. You can have a normal oxygen level, but you're not able to use it. Same as glucose.
I wanted to, before you actual diagnosis, what was your family thinking and your friends, and how were you managing to work if you were?
Before I got the diagnosis, was unable to work. I tried repeatedly to work and to do things. One of the things was that even on a day when I felt okay, and I would try and work, I could my energy levels would sap really quickly. I could start. I noticed that when I did things like I tried to do some digging, tasks, I never gave up. I mean, all this time, especially as I was being told that there was nothing wrong with me, I actually part believed what I was being told, because during the periods when you don't have an illness, you start to think that you must have something psychologically wrong with you. So I would try again and again. And one of the things that I found was even small tasks, if you did over a period during the day, you could end up with serious breathing problems by the evening. Not just energy, but you could become abnormally weak, very ill very quickly. But no, I took a lot of chances. I did a lot of things that even when I was ill, I actually remember trying to do things when I was dizzy, when I sometimes at a very low level. You know, I said that you suffer from confusion, and it can affect you really badly. At the sort of low level, it can cause just continuous dizziness. I think other people have termed this brain fog at an even lower level, where just find it hard to think. But this was really bad dizziness. I would still try and go out and do things, and still try and I suffered very badly because of it. But I would go back again and again, keep fighting. I actually couldn't believe that there was anything wrong with me. I couldn't understand why doctors hadn't identified what was wrong with me. And because of that, I thought, well, it must be in my head. I just had to keep, obviously, if I kept trying to, one of the things I had in my head was that if I actually fought harder, against it, I could break through this thing. I could actually, because of all the years of training and all the rest of it, it was me pitching myself against this thing. It was the wrong thing to do. On a few occasions when I'd actually repeated the same thing by the third day, I could put myself in bed for weeks. I would start a task and may start to fall ill. I would go back the next day after having recovered overnight. I was actually given oxygen at one point. They didn't know I was having breathing problems. I had oxygen at home. Would use the oxygen and recover partly and start again. By the third day, I could be in serious trouble. I couldn't reverse. I basically wasn't able to get over these problems. I couldn't recover as I could do in the past. There was no normal recovery whatsoever.
So if you were at least partially buying into what the doctors were saying, that you had a somatization, a psychological problem, how was your family responding to that?
Absolutely. This was one of the worst problems. And my brother was a doctor. And here we go. Without naming but basically he actually went back and told everyone in my family that it was all in my head, and they just turned their backs on me. I ended up having to manage without any belief whatsoever. Because of his status as a doctor, he was believed, and I wasn't. A doctor over a sculptor. I mean, basically, I've never had anything go wrong with me before in that way. Never needed any sort of. But I was really shocked in the way that people treated me when I got, when I fell ill, and I'd actually gone to them almost begging at times, because one minute I would have abdominal pain, the like of you I can't even express, but the whole thing could cause all sorts of problems. It could cause breathing problems. I'd have breathing problems. I would be extremely weak, close to passing out at times, and people would just ignore me after this. Except this good doctor that I had, who actually believed me and started trying to get me to other specialists. I saw several neurologists. This is a neurological illness that I have, but they all, because of the somatization, they actually, two of them actually turned around and said, "Oh, it's classic somatization." They actually did some investigations as well. Two of them were top neurologists, and noting that I had definite dylactic illness, they were not able to understand it at all. They don't have any comprehension of this particular problem, and this is why I believe that it's a good probable cause. It's a hidden illness. It's something that dylactic acidosis is supposed to come from the realms of short bowel syndrome. Now, I'm an example of someone that doesn't have short bowel syndrome that has it, and it's unlikely that I'm the only person to have this. And I believe that this is why it's been hidden for so long. There's a chap on here called, this is a Dr. Luke White, who is a gastroenterologist that's written a lot, and he basically believes that dylactic acidosis is far more common than was previously thought. He also believes that anyone with bacterial overgrowth can develop a dylactic acidosis. A lot of patients with chronic fatigue and ME have bacterial overgrowth. I also believe that this is it's an totally unexplored continent in terms of the gut biosis itself.
To a lot of people through interviewing them for the podcast that are quite ill, the medical system either gives them a somatization label, or they just sort of throw up their hands and don't know what to do, or they cause them harm. But a lot of these folks eventually figured out on their own what their problem was through their own research. How did you finally get the proper diagnosis?
Took a long time, but it was also due to people like Malcolm Hooper and Dr. Myhill. I actually went to Dr. Myhill some years ago, and at the point they cut off my funding, she just asked for tests for gut biosis. So the NHS were funding her, and then cut my funding just at the point she'd found the test would have revealed the problem. Malcolm Hooper, Professor Hooper, is one of the kindest people I've ever met. Both of them are heroes of this, and they've. If it wasn't for him the strength that he gave me, I wouldn't have been able to have gotten through this at all. But the clues came in terms of my response to antibiotics. When the infection itself, that clue had been there for a long time, and the really good doctor that I was seeing, I had him for I think it was, I'm trying to work, I saw him in first of all in 2001, 2014, about 13 years. When he retired, he left me a lot of antibiotics so that I could treat this on my own. I wasn't expecting anyone to be able to understand or take, and he probably understood that as well. So he left me enough to be able to treat this myself. And from that point, I realized I was on my own. I started to investigate. I realized that I was in a lot of trouble. And I was probably by 2014, by 2016, I was expecting to die from this. The antibiotics I was becoming resistant to. And that was the point at which I started to get worried, and it gave me the impetus to actually look further into this. And I came across galactic acidosis quite by chance. I was looking in the right direction, but it's after a conversation with Professor Hooper, who was talking about fermenting gut, that I got the idea. He's written an awful lot about fermenting gut as well, and this is partly to do with that. It's misfermentation, basically. It's whatever's causing this is causing a process whereby natural gut bacteria build up in the small intestine and then cause massive amounts of production of dilactate. But this is due to this imbalance that occurs for whatever reason, and this is what needs researching.
So how did you find out it was lactic acidosis?
Right. This is at the point that my antibiotics were failing, quite literally. I've been researching for probably about a year or so, and literally at the point that I was expecting. I'd written my will out and was expecting to die from it. When I came across dilactic acidosis and the symptoms, I realized that they were mine. I was absolutely certain. I made an appointment with a dilactic consultant specifically, and it was diagnosed virtually on the spot. I took in most of my records, which showed things like drunk-like confusion, breathing problems, all the rest of these things, which are classic symptoms, and my response to metronidazole and other antibiotics. And he was pretty certain from day one. He said it was the most likely cause of my problems. And later, he's actually made a statement that it was the cause of my problems going back 20 years.
So how did that feel in that first session when he pretty quickly diagnosed you?
It was good, but I got something else from it as well, something I hadn't understood at all. And it was worth every penny of going privately to see him, because he gave me a diet. The diet itself restricts the use of carbohydrates and sugars and restricts the production of dilactate, the neurotoxin, and that was priceless. I've been able to apply those things. I haven't applied it absolutely or properly because I still get some episodes, but it means that I do have a means of controlling it without antibiotics. I've made a lot of mistakes, and there are periods when I can't get hold of the correct foods. I'm wondering if Brexit's going to have be a bit of a problem for me as well. If we all find it difficult to get foods in this country, and in a month's time, but we'll have to see.
That's interesting that a low-carb, low-sugar diet would help you so much, because so many folks with different types of autoimmune illnesses seem to do better on diets like that.
And there's a reason, I believe, because bacterial overgrowth also affects the gut, and it can damage the gut badly enough to cause autoimmune problems. one of the reasons this is all connected, but one of the reasons I realised that lactic acidosis has never been understood as an infection, because that's what I believe it is. Although it's bacterial overgrowth, I believe that it's an infection. It's a hidden infection, is because it acts like an infection but doesn't raise your temperature. The bacteria remain in the gut. They don't cross into the bloodstream as a normal infection and spread in the bloodstream, and there's no raise in temperature because of that. In general, they stay within the gut, but the metabolites, which are things that make you ill, exit the gut, including lactic acid. But small quantities will damage the mucosal lining and may cause an immune response. So the diet that's logically a possibility of a cause of autoimmune disease as well. Bacterial overgrowth may be causing a lot of problems.
Wow. So I'm just thinking, as we've evolved as people, that we've consumed more and more carbs as time has gone on.
Yeah.
It's hard not to make that link, although correlation is not causation, but in your case, it is causation, or it's a contributor.
Yeah. But there may be other causal links as well. There are so many, I can list a lot, including antibiotics themselves. Antibiotics can select for certain types of overgrowth through a process of both, they can favor certain bacteria, but they can also cause bacterial overgrowth through resistance. When certain bacterial colonies gain resistance, they're basically given, they're basically helped. Continued use of antibiotics will decimate other colonies to the advantage of certain colonies. And that means that the introduction of antibiotics, it seems to be from the point at which we started to get chronic fatigue and ME, but we're also using these things in our farm animals. We're getting low levels of antibiotics coming through, which means we're educating these bacteria to become resistant with low levels within food products as well. That's one of the ways. So if you look at both the high use of carbohydrates and the introduction of antibiotics and a number of other factors, I mean, use of non-steroidals, there may be a number of contributing factors. I wouldn't imagine until a number of people have been diagnosed and you can get some statistical data on this and you can actually find out correlating factors that this will actually be useful. But I'm sort of guessing ahead at the moment. But I believe antibiotics are a part of the problem, although they're also used as basically I see antibiotics being used rather like in a very primitive way, because you're just using it to knock the bacterial overgrowth back. In actual fact, you're probably making it worse. For the period of time that I've used it, they've given me an advantage. I've been able to knock it back until I became resistant. But it's rather like trying, like a Stone Age man trying to use a flint axe on it really is a primitive way of dealing with this. I'm aiming for a fecal transplant at the moment. That's where I'm going. What I want to do is to try and reverse the condition altogether. I've had some success, temporary, with probiotics as well. But I've used probiotics with lactic acid producing bacteria. The whole thing is really complex, and it's really, I really need a lot more help. I'm not really getting that help from the consultants that I'm seeing. A lot of them barely understand this. I don't think that they understand any more than I do. And there's a lot of controversy. In fact, in terms of probiotics, you read that lactic producing bacteria may make things worse. Well, I think the thing is that just like E. coli, there's good forms of E. coli, bad forms of E. coli. You can use certain E. coli can be used as a probiotic. You can, but it depends upon the actual type within the genus. And nobody's mapped the gut biome. Nobody has any idea of differences in terms of DNA, in terms of it's an unexplored continent. And these are just a lot of this is a lot of guesswork on my behalf, just to try and keep myself alive. And I'm hoping that I can track this from the outside, it'll be very difficult without the sort of help that I need at the moment to get a full reversal. It's difficult to live with. It still is. It's a lot better than someone with ME that obviously doesn't have that doesn't have a diagnosis. And I imagine there will be a few people with this. I believe that it may already have caused some deaths. It's a likely suspect. I mean, it's a multiple neurological systemic producing bacteria.
Diagnosis. How did that, if at all, change how your family and especially your brother has reacted?
No, it hasn't. In fact, I would say that I'm fighting the hospital. I'm fighting the NHS. I've actually I've sent all this information off. I've asked them to investigate. They don't want to investigate. The local NHS are fighting tooth and nail at the moment. And my brother is basically fighting me himself. When I was given this psychological diagnosis, he knows the doctor that gave it to me. The doctor saw me for 10 minutes, and my brother used this as a reason he said, oh, we only have 10 minutes to see patients. Well, at that time, we had an awful lot more time than we do now, you know. He said 10 minutes. He said it's not his fault. It's that you know, basically we only get 10 minutes to see patients. You don't give someone a somatization diagnosis that will affect them for the rest of their lives within a 10-minute appointment. I saw 2 psychiatrists as well. They saw me for about 20 minutes apiece. This is how bad this is. I actually had raised ALT while they were giving it me. I had raised CK levels. A doctor, this was just before I went to this really good doctor. I can't use names, which makes it very difficult, and I can't give surgeries. But the doctor that I was seeing at the time was retiring. I'd actually seen him for a few years, and he wrote a concerns letter stating that the raised ALT he believed may be due to underlying pathology, but the psychiatrist actually went ahead and gave me a somatization, which actually made it impossible for other it made life so difficult that other doctors weren't ever going to take me seriously from that point, because somatization actually became my diagnosis. And I was repeatedly told that I was somatizing. When I went into A&E, even when this the doctor that wrote to A&E, I think I had 3 doctors made statements that I wasn't somatizing and asked for blood gases. A clinical psychologist that I was sent to afterwards, who was very nice, actually treated me very well, actually wrote a letter on my behalf asking for blood gases to be done as well. And they were never done. This was from 2002, so 2002, 2003, I think a number of doctors were asking for blood gases which could have identified this, but because the somatization was already in my significant medical history, first thing that a doctor would see, when I entered A&E, I was treated as though I had a psychological problem. That was it. So in 18 years, I was left without the investigations ever being done. I think there are some serious issues here for a lot of other people. I mean, I'm also really worried. I was very lucky in terms of very lucky to have got a diagnosis at all. Very lucky to have come across very lucky to have come across people like Professor Hooper. Very lucky to have just found lactic acidosis, which is a really supposedly rare problem. But other people out there, I believe, will be just lost within this maze. This is and this is what I'm trying to fight for at the moment. I'm hoping that I can at least get some of these people out. I believe, like Sheedy and the Australian researchers, at least there must be a subset in there that are that have bacterial overgrowth as their problem, whether it be people with IBS, people with far worse forms of bacterial overgrowth. I believe that there are more than one. There are probably combinations of bacterial overgrowth. there are a number of dilactic producing bacteria that Sheedy and Australian researchers found. And I believe that there's a good possibility that those people with really serious problems may have and may be producing dilactate.
And so anybody who's listening and they're thinking, well, you know, maybe that's what's going on with me, how would they get a diagnosis, even if they're not in the UK? What's the test that they need to seek out?
2 stages. The first with bacterial overgrowth is itself, just bacterial overgrowth. So you'd go to a gastroenterologist and say, usually this is because you have gut symptoms. The gut symptoms are the illness itself, and gut symptoms are they're part and parcel of the same thing, but the gut symptoms are specifically you get bloating, a lot of burping, a lot of production of gases, you can get abdominal pain, and things like, one of the things that I found that actually you have problems eating things like carbohydrates. If I have a meal of carbohydrates now, I'll just virtually pass out. I'll go to, virtually fall asleep straight after. I mean, it's really horrendous. I can't stay awake. If I eat the low carb meals that I'm having of meat, vegetables, etc., even some yogurts, which with some carbohydrates, I can, as long as I keep the carbohydrates very low, I don't have this problem whatsoever. I've forgotten the question.
So it's 2 stages to get tested.
Yes. The first, I was diagnosed with bacterial overgrowth. So you would go to a gastroenterologist, ask for a second opinion from a gastroenterologist, especially if you have gut symptoms of bloating, maybe feeling sick, you may be bringing food up, burping, getting abdominal pain, and just having general gut problems. Those are a good sign, and that's the place to start, by going to a gastroenterologist. The next is going to be far more difficult, because I'm probably one of the first people to be diagnosed with this, and without giving the name of the gastroenterologist, I think you're going to have to be rather pushy and actually ask for tests. I've just recently asked because I needed to find out if what would happen if I actually fall ill in Cheltenham, where I live. I've been told that there are no tests for dilactic acidosis, only anion gap, which means I have to be really very unwell for any test to be performed whatsoever here. But you need to find out where you can get tests for dilactate itself, possibly through the people that Sarah Myhill use. I think it's John McLaren, I can't remember. That there are some people that'll run these tests themselves, probably privately. It's well worth the expense. If you've already been diagnosed with bacterial overgrowth, it's definitely worth the expense, and probably worth asking for a dilactic consultant, expert gastroenterologist.
So you said that because of your extensive use of antibiotics, you've grown resistant to them, and that you're thinking of trying a fecal matter transplant. For folks who aren't familiar with that term, what is that?
It's basically using poo from a super donor to actually readdress the bowel the dysbiosis itself, to actually put back a good working bacteria into your gut. I believe that there's a super donor that they have at the moment in the UK who's reversed a number of other gut conditions, and it's for me, it just seemed logical that this would be able to be a good way to go with mine. Now, nobody with dilactic, I don't think anyone in this country has actually had it done, but I have done some reading, and I found that that there have been a number of cases in which there's been a reversal through this, which also means that if there was the possibility that a number of people had bacterial overgrowth within chronic fatigue and ME, then there's a possible way of reversing it. But I'm pushing ahead at the moment. When I went to go and ask them about when I went to the specific hospital where you can get this done, they've not even, the first gastroenterologist I talked to said, I've never heard of dilactic acidosis. He said, I'd better Google that. I thought, right. Anyway, the chap that runs the fecal transplants is now doing further tests for me anyway, the tests that should have been done a long time ago. So hopefully those will all be done and I can then get on and try and reverse this as quickly as possible. But no, I'm literally pioneering, trying to get this done. I've had to literally diagnose myself and work out my own forms of my own treatment.
Wow. So a sculptor becomes a medical person.
Unfortunately,
yeah.
The last thing I wanted to do, I'd just rather get off now and be sculpting. As soon as I can get away from all this, the better. But there are a lot of other people that are obviously very unwell out there, and I need to get as much information as I can out there for other people.
Thanks for sharing your story, Paul. I agree with you. I'm sure you're not the only one who has dilactic acidosis, and there's many other people that have yet to be diagnosed. So hopefully with the information that you've shared, they can start going down that path and figuring it out if maybe
Can
that's
I say one other thing?
Oh, absolutely.
I think that there are possibly other forms of bacterial overgrowth as well, not just necessarily dilactic forms, and there are probably a number of metabolites involved as well. They may be as bad, worse, or I have no idea until that research is done. Like I said, this is an unexplored continent, and it's badly needs researching.
Yeah. Well, maybe we'll check in with you in a few months and see how you're doing.
Yeah.
And get an update from you.
Lovely. Nice to meet you anyway.
Thank you, Paul. And just for the folks that are listening, we'll try and put in the show notes the links to the folks that Paul was mentioning and any other resources that he thinks would be helpful. Okay, thanks, Paul. Rest hard.
All the best and good luck. Good luck to everybody. I know they need it.